And good morning, and it certainly is, because it turns out one of the biggest problems with prostate cancer is that the scans we use right now often don't show the full picture of where that cancer has spread throughout the body. So doctors are often stuck making an educated guess on how to best treat the patient. Well, now, a major advance in diagnosing and treating the disease is giving patients new hope. When Michael Rosenblum was suffering from back pain 5 years ago, he figured a trip to the orthopedist and physical therapy would fix the problem.
I was healthy. I felt as though I could be playing stickball.
But then a scan revealed something life-threatening: metastatic prostate cancer that had spread to his bones.
I thought it was a back pain. It never occurred to me.
Michael tried all the standard treatments, including hormone therapy and chemotherapy. Nothing was working.
I was out of options for him, and one which would retain his quality of life and which was likely to work.
So a team of doctors at Memorial Sloan Kettering Cancer Center tried an experimental approach.
The usual way of imaging cancer with PET scans, that doesn't work so well historically with prostate cancer. So in prostate cancer, we were left with a real blind spot.
Dr. Michael Morris says traditional scans often don't pick up cancer that has spread.
The best treatment plan can only be as good as our knowledge of where the disease is. So if you have inaccurate knowledge of where the disease is, you can't make a really accurate treatment plan.
But with this new type of PET scan, prostate cancer cells are illuminated wherever they are by using a special molecule that seeks out cells with PSMA, a marker found on at least 80% of prostate cancers.
This is a PSMA PET scan that shows the lesions in the bone lighting up. With a traditional PET scan, we would probably not be able to see the entirety of the disease with such clarity.
Once Michael's cancer cells were identified as having PSMA, doctors then used a new treatment: liquid radiation, that targets those cells and destroys them without hurting the surrounding tissue. You've been doing trials with this new drug. How promising is it?
This is a really promising drug because it really does allow patients to live longer and to live better.
Is this a game changer?
Absolutely. It really is. We can develop a treatment plan that targets that disease in a way that we could never do it before.
Michael underwent 6 infusions as part of a clinical trial and was declared cancer-free.
It makes me happy to have you here.
You know, I don't know how to express my gratitude.
This is the post-treatment scan after the last treatment. There is no uptake in the bones anymore.
I'm just happy to be alive. I'm happy that I'm feeling well. And I'm happy that Dr. Morris is happy with my progress.
You know, when Michael Rosenblum was first diagnosed, his PSA, that's the standard blood test, was 100. That's through the roof. Now it's down to 0, which is really remarkable. This new PET scan technique was approved by the FDA just this morning. So now doctors expect this to become the standard imaging tool for prostate cancer, which is really a significant step in diagnosing the disease. The treatment aspect, that's the liquid radiation, is still being studied in clinical trials, but new data is being released soon that doctors hope will bring it one step closer to also becoming approved.
Dr. Torres, I mean, it really does sound so promising. Any idea at this point what this could mean for the treatment of other cancers?
And Craig, this is a big step forward because we're getting closer to cracking the code on how to detect those cancers. And we're doing that on a microscopic level, finding different molecules where we can find the cancer throughout the body. Once we find it early on, we can treat it early on, which becomes more successful. There's no reason to think this won't also add towards becoming a technique for other cancers as well, Craig.
That is amazing news. It really is.
Dr. John, we always love it when you bring good news.
Yeah.
Thank you, sir. Thank you very much for that.
And I love bringing good news, so there you go.
Right, I bet you do. Thanks, Dr. John. We're going to stay in the health